Assalamualaikum, I am Ibanta Cisneros. So for today's video, I am going to perform a lumbar puncture or what we call the lumbar tap. So it is a procedure that is also known as spinal tap. It is a medical procedure in which a needle is inserted into the spinal column of a patient. Spinal column or spinal canal. So the purpose of this is to introduce the medicine through the spinal column of the patient and for diagnostic purposes. So the equipments to be used are first we have the sterile gloves, the sterile tray, a 5 cc syringe needle, and also treatment towel and towel that needs to do a puncture. So before we start the procedure, I am going to disinfect my hand with alcohol to minimize the spread of microorganisms. And also, we need to consider this thing. So there are contraindications in performing a LP or lumbar puncture. So the infected skin over the puncture site increase intracranial pressure or the ICP. So from any space occupying lesions, lesions including mass or abscess, and trauma or mass to lumbar vertebrae. So there are also important things to remember in order to minimize the risk for the patient and also for the nurse. So we have to maintain asepsis, the cleanliness, and instruct and observe and reassure the patient and the family during the procedure, and also instruct the patient to remain in bed without pillow after the procedure for at least 6 to 8 hours to prevent spinal headache. So first, we have to determine whether the patient has already obtained the consent. This is to assure that the patient is aware in doing the procedure, and also explain the procedure to the patient and describes sensation that are likely during the procedure. Example, the sensation of cold as the site is cleansed with solution, a needle prick when local anesthetic is injected. So second is to determine whether the patient has any questions regarding the procedure or misconceptions about the procedure. So they assure that the patient and the needle will not enter the spinal cord or cause paralysis. And then instruct the patient to void before the procedure. So moving on to the procedure, the patient is positioned on the side of the edge of the bed to perform the procedure properly without any hesitation and for the patient's comfort. And then a small pillow may be placed under the patient's head to maintain the spine in a horizontal position. A pillow may be placed between the legs. So as you can see, our patient is not a real patient. It is improvised. It is made of a pillow, and also the nurse assists the patient to maintain the position to minimize the risk for the patient, and also the nurse describes the procedure step by step to the patient as it proceeds. So the nurse assesses the patient to maintain the position, and then the patient is encouraged to relax and instructed to breathe normally. And then the nurse describes the procedure step by step to the patient as it proceeds. The next is the physician cleanses the puncture site with antiseptic solution and drapes the site. So as you can see, the drape is also has already been placed into the patient's where the site, where the puncture site, and then a specimen of CSF is removed and usually collected in 3 test tubes labeled in order of collection. A pressure reading may be obtained. The needle is withdrawn. So the physician injects a local anesthetic to numb the puncture site, and then insert a spinal needle into the subarachnoid space through the fourth and fifth lumbar interspace. So this is where this is the location or the puncture site, and then a specimen of CSF is removed and usually collected in 3 test tubes labeled in order of collection. A pressure reading may be obtained, and when the needle is withdrawn. So the physician applies a small dressing to the puncture site. So assuming that the physician is executing the procedure, and then the tubes of CSF are sent to the laboratory immediately. So and then after that, the doctor will have its own will have the instructor to chart and document the time and also the character and amount of liquid. The specimen sent to the laboratory and reaction of the patient. So for the post-procedure, so instruct the patient to lie prone for at least 2 to 3 hours to separate the alignment of the dural and arachnoid needle punctures in the meninges. So monitor the patient for complication of lumbar punctures. Notify the physician if complications occur. So I have already discussed what's the procedures, and then I am going to perform the lumbar pack. So first you have to put the gloves on. Remove the packages of the 5cc syringe, and then after removing, also remove the cup, and then expose the site for the puncture, site of the puncture, and then insert the needle and after the insertion, withdraw the needle, and then using a collecting tube or collecting specimen, label it to the puncture site, and then wait for at least 3 to 5 minutes until the specimen is being collected. And then after that, put the specimen collected to the area, safety area, and then assume that the specimen already been collected, and then cleans the puncture site and to minimize the spread of microorganism and infection, for the infection control, and then cover the puncture site, then position the client or where the client comfortable, and then remove the gloves and discard. And after the glove, discarding of the glove, document the procedure and document the data and also the name of the doctor, chart everything that is not necessary for the patient, and ask the patient if he or she is comfortable on his position after the procedure, and then send the specimen to the laboratory for findings. So that would be all. Thank you.